Okay, so the actions that have come through the conversations, thank you so much for adding to the Padlet. I know it's a lot of a process, and it's, you know, we could spend the whole day speaking about each of these topics, but hopefully that really gathers and shares, you know, in a space that is a resource for everyone, the resources, and we're going to actually think about actions. But I did want to invite a few different people who are representing kind of decision makers, but in the broader sense, I guess, different structures, people are working in different ways, to think about actually how do we move that change forward as we go ahead. And so we have our speakers. We have Anthea Innes, a Professor of Health Service Research at University of Highlands and Islands. We have Louis Peterson. In fact, I might ask you to introduce yourself. I feel like that's a little bit nicer, so I'll pass it over. Okay, testing. Excellent. I am Louis Peterson. I'm from Shetland Islands Council, and I'm a professional imposter. Partnership officer. I basically work with a lot of our public bodies and local bodies in Shetland, and while I might not directly be making policies, I'm in the room when a lot of policies are getting made, and I suppose trying to bridge that gap between the community and the people that hold the purse strings and make those calls. All right, Shetland.
Hi, my name's Anthea, and I'm a researcher. I've been researching for about 30 years in ageing, dementia and mental health, and community-based research has been something I've intentfully been involved in for about the last 15 years.
Hi, my name's Liz, and I live in Orkney, and I'm part of the Young Islanders Network, and I'm the rep for Language, Culture and Heritage, and I'm currently working with our Heritage Society on a project.
Hi, I'm Ala. I'm co-heading the Regenerative Futures Fund in Edinburgh. It's a 10-year fund to end poverty and make Edinburgh anti-racist, and a lot of our projects that we're funding right now are focusing on community research.
Hi, I'm Katie. I'm from Research Data Scotland. We work with public sector data, trying to make it simpler for researchers to access public sector data, and I spend a lot of my time working on and thinking about how do we connect that large-scale data with researchers and with the people that data represents.
Hi, I'm Kirsty. I work with the Ideas Fund, and I'm lucky enough to work with lots of the amazing projects that spoke today, as well as spend a lot of time with Lewis, which is wonderful. And yeah, the Ideas Fund works in 4 different areas across the UK, and we've been going for nearly 5 years now. So yeah, looking forward to sharing some reflections. Thanks, Lewis.
Thanks. You're going to keep hold of it, because our first question is, you've been in these conversations, and so we'll go just back the way, and maybe we'll mix it up at some point, who knows, to think about a reflection from the tables that you were at. I guess something that has really struck you in that conversation, something that you're kind of pondering would be really useful. So maybe let us know which table you were on as well, and if you can start, Kirsty.
Cool. I'm not prepared for this, but I'll take my mind back. So I was on the health and social care table. It was a really rich discussion, I think, with people with all different kind of perspectives. Our NHS friends were getting a bit of a grilling, I think. But yeah, we were thinking about sort of what's the appetite for some community-led research work, and discussing what were we discussing on the group? I think people were sharing different reflections about short-term funding, the barriers there, how actually sometimes some of the work, there is an appetite for this within the NHS, but then cycles, people change. You could do 90% of the work, and then for one reason or another it might get pulled. Just lots of frustrating situations where actually there's lots of people who are really interested in this work and want to see it happen, but for one reason or another it's not quite joined up. So yeah, it was a really rich discussion. I think a lot that people are connecting over and will continue to connect over. And yeah, me personally, I think one of the areas we're interested in the Ideas Fund coming up is thinking about some of the impact on health systems from this work. So some ongoing conversations that I'll be picking up personally.
Jesse.
I was on the same table, so I was on the health and social care table. So it was interesting, a bit of the discussions about what do we mean by health and social care? Like, is that just NHS? What do we mean by service providers? Who's involved in that space? You know, there's lots of different organisations, and just how complex that space is as well. Summarise the kind of challenges with funding, the time to build relationships and things like that as well. And I think something that came across that Sarah Jane said about is about sharing evidence across as well as up and down within structures. So everything's so interconnected, as we've heard today. These topic areas don't sit by themselves. So about sharing evidence across, and I really liked that phrase.
And I was on the funding and sustainability panel, and I think quite a lot of overlap, even though, you know, health and social care, but also just generally speaking about the need for funders to be more agile and to just reflect on the nature of the amount of barriers that are preventing community research from taking place. If you look at the Padlet, there are so many notes because Sleepy Bat, I think is the name that they were given, has really done a really good job of capturing the depth of that conversation. Some of the things that I took from it was that the call for funders to look at the process just as much and sometimes more than the outcomes of the research, and also taking that across into, again, for knowledge sharing, so quite similar to that, and also a call for networks to be strengthened, collaboration as the way forward, whether that's across the rural-urban divide in Scotland or across the UK, which is quite siloed, or even looking internationally. Yeah.
So I was on the youth involvement table, and we had a good discussion about policies and policy writing. And we kind of came to the conclusion that young people and young people's opinions shouldn't be separate, and we shouldn't just have youth policies and regular policies, and that it should all be together. And that young people can have equal parts in producing policies, and that they shouldn't be seen as having a smaller part than adults. Yeah.
So I was on the community research partnership table, and so was Louis, so hopefully we'll have different reflections. So there was a real passion around the table for community-based research and these kind of partnerships, and it's like we're preaching to the converted in a way, everyone in this room, because there's so much good work going on, and people, the fact that we're all here, we're in favour and support of it. So I think what I was struck by was when we were really talking about the challenges of making community-based research and the findings more accessible to everyone, and so they actually have impact and bring about change at a pace that's not going to frustrate the communities who take part in research. So that's kind of what I took from that. There's a real passion for this, but how do we actually make sure that we've got maximum impact from the work?
Yeah, just to add to what Anthea said, I think we spoke a lot about how important relationships are, and how central they are to any research done, and that perhaps culturally there's been a bit of a relationship breakdown between some of the people that are taking part in research and the organisations that commission the research. Also culturally, we kind of discussed there's maybe a bit of a lack of respect or a devalue of data and being and intellect and academia. There's almost a suspicion of it right now globally, not just in Scotland, and that we've got a bit of a kind of a, I think we called it an enlightenment, or we need to almost kind of bring back that valuing of using intelligence and using data and kind of using expertise as well.
Thanks, Louis, and that certainly really resounds even with us personally. Like, one of the things we've been thinking about for a very long time, anyone who knows us, is that we've tried to rename ourselves from Science Ceilidh for a very long time. Not because Ceilidh isn't the word Ceilidh necessarily, it means bring people together, but the word science it feels very often like the work we do is research, not science necessarily, but actually one of our steering group members was talking about this actually, and being an organization with the word science and standing for science, even if it has its challenges and, you know, around power dynamics, is not insignificant right now from an international perspective. So it's something that we've been thinking about a lot. Thank you for those reflections. I'm looking through the Padlet desperately to see what people have suggested as their asks, and you've already picked up on a few of them. But I think one of the asks, I think one that's really struck me, particularly in the health and social care, but I think there's kind of themes of that, is around how do we focus change on prevention rather than reaction? I do feel like that feels like a really common issue. You know, people might have been familiar with the Christie Commission, which looks at like how much negative spend. So we spend so much money on things that could have been prevented down the line. And so I'm inviting any of the panelists. I don't know if you've got any reflections on that from the work you're doing. Yeah, prevention rather than reaction.
Certainly, there'll be a few people maybe aware of the Fairer Futures partnerships that are taking part in some different areas of Scotland. So the idea around the work we're looking at doing in Shetland is with a child poverty lens, but it could be wider than that, and that is all about early intervention. And I suppose it's the rationale behind that is that we certainly locally we find it hard to recruit. Budgets are falling, so something has got to give basically, and I think everybody's sort of realising that just now. So although it's not the best, you know, you'd rather it was a positive reason that we were doing that. I think everybody's having to think that way, and maybe that kind of necessity breeds innovation. Maybe we are starting to look that way, I would say.
Thanks, Louis. Any other? Thanks, Liz.
So I think that with a lot of high up people, that they kind of undervalue young people and teenagers, and that they all just kind of seem to think that they're just a bit thick and a bit stupid and they don't really understand anything. So then they assume that they can't help with decision making and that their opinions and life experiences aren't valuable enough. So then they don't end up getting involved in that decision making. But now they've suddenly asked young people for their opinions on things. And I think that's kind of made it seem, all the young people think like, well, why are you asking us now? Why did you were ignoring us however long ago? So I mean, that could have been prevented, and now the reaction sort of discouraged young people from actually taking part in decision making.
Thanks, Liz. There's definitely something there about kind of almost, I feel like we've talked about a few, like the kind of historical precedent and power dynamic, and actually that there's kind of reparations are needed around that, or kind of like a healing process of trust again. Ara, did you want to come in, or?
I mean, I guess I can. I was just handed the mic. The fund that we're running for Edinburgh is a prevention fund. It's a upstream prevention, whatever you want to call it, systems change fund. And I guess my plea is, we also are really privileged to work in Edinburgh Futures Institute in an academic setting where we're connected with public services that are connected up in something called the Prevention Hub, which is a collaboration between Public Health Scotland, Police Scotland, academic researchers and communities. And I think maybe just signposting to it is happening at a very small scale, but that directive has come from Scottish government. So I think this goes back to what we said at our table, which was reflecting beyond the NHS and on the role of maybe Holyrood and local authorities. Sorry, Louis. And people that are in the power to sort of set up these bodies and sustain them is really important. And then the other thing I would say about when you're doing systems change and prevention work, getting the language on that aligned with the communities is really, really a long road. And I mean, it can't be understated how hard it is to have as a fund or as an organization, one idea of what systems change and prevention and upstream means, and then to have the people around in your community align with that is really, really a journey. And so for everyone who's going to embark on that, if they're not already, to make sure you focus on language. It's my own learning.
I was just going to say, I think a really good reflection from this morning that kind of taking the time and the trust and the care is the co-priority survey conversation. I think like credit to everyone in that group, and that's taken a lot of time. And I think also to you, Lewis, just to say the Community Knowledge Matters Network, I mean, this is a credit to you, 300 members. It's not even been going that long, really, a couple of years now. And yeah, you can really feel so much commitment from so many people in this room, and this work's really established. And I think in terms of work that's, yeah, taking a really a careful and considered approach, I think this is a really good example of it as a piece of infrastructure work, if we want to call it that. So yeah, I just thought I'd reflect into this room, yeah. I think a lot of people are really appreciative of this space.
No, thanks, Kirsty. Appreciate that. Anthea.
Just to pick up on language, I think if we talk about prevention, that gives also false expectations, that there's a cure for some of these things, we can prevent these things. And so I think sometimes to make things manageable and basically to manage expectations, if we talk about risk reduction, or I just think prevention sounds like there's a cure. And so we're back to this, there's a magic pill, there's a magic something that's going to make everything better, and we're never going to make everything. We can't prevent everything, I don't think, but we can reduce the risk of certain things. I think even just that can make things more realistic for people.
Thank you, Anthea. And I think that's, yeah, very well said. There's an interesting comment, it builds a little bit on maybe some of the things around that kind of financial justification or costings around it. So there's ones particularly around, being able to provide financial costings for local authorities, for councils. So, the idea that actually by investing this money back, you get a certain amount of money in terms of return. And I guess I'm interested in that kind of, Louis kind of talked about the necessity of it and the kind of, and actually there was a really interesting comment earlier in the day, which was around, I know this is something that Murray Wellbeing Hub have talked a little bit about as well. Is like sometimes, obviously community-based led is really important, but in some ways, where does that delegate so much responsibility because it's seen as cost savings or something like this? Like, where's the tension point there about how do we balance to make sure, of course, we want empowerment and more powers, but at the same time to make sure that feels sustainable and is properly resourced. Big question.
You looked at me very apologetically when you gave me the mic there. I suppose it's maybe back to setting expectations, and there's no magic pill, but to me there's maybe just some basic things that don't actually cost any more money that we could be better at, certainly from a local authority point of view. Feedback loops, for example, when we've done community engagement or consultation or whatever we like to call it, then I think we could be a lot better at communicating during the whole process. So not just before and saying what we're going to ask people, but actually coming back after we've made that decision. If we can't give people what they feel they need, then can we at least explain to them why? And do it in a constructive way, in a way that brings them with us. I took part in the active listening walk, and it kind of made me feel that I think public bodies and local authorities, that's kind of almost what we need to do with the community. We have to kind of walk with them a little bit and listen, but at the same time ask the questions and give feedback when we, and I suppose let them hear what they've said, to give it that kind of coherence as well.
Feeding back. Katie?
I think one of the things that I noted down that's kind of come up a lot today is about like the output sharing from things. I don't know if this is going to particularly answer your question, but like you were saying, that feedback loop and that output sharing, I think I know that I could be better at sharing what we've done, and it was really nice hearing it earlier. I think that was I'm blanking on who it was, but had the timeline of where the projects didn't finish, they ran into another project, and that feels really key for the sustainability is not having a project end, but keeping the momentum up. But as I have, as an organisation, we've funded projects in the past, is capturing, and I'm sure you'll find a similar kind of challenge of, you kind of, the funding ends, you know, January 2026, and you get a report in January 2026, but that's not really where the impact ends. That's not where the work has ended for anyone involved. And so often you go back to people a year later and they're still working on it. They're just kind of unfunded because it's led on to something else and it's led on to that. So I think there's a lot in capturing that work that goes on beyond the end of a funding deadline as well, because it's there and it's valuable.
Thanks, Casey. There was definitely a lot of comments that about kind of for funders to have more responsibility in connecting together themselves, perhaps, and taking on that responsibility more. I don't know if it needs further comment on that. I don't know if anyone wants to speak to that.
I was going to say I agree. I think it's on kind of both sides. The funders need to capture that more and make those connections, as well as the people that have received funding and where that then leads to, and that all getting captured. But yeah, I think it's on the funders to be capturing that.
Yeah, I think people from the Ideas Fund or funded by the Ideas Fund will be sick of hearing me or my colleagues say this, but we're now in this phase of evidence building, as we're calling it. So we've got 2 more years left of welcome funding. We're hoping something exciting can happen beyond that. But our focus really is about building and gathering the evidence and learning and sharing that at the moment. So yeah, that definitely means with other funders, with other stakeholders, yeah, and hopefully everyone can come along on this journey with us. And yeah, it's quite there's a big mountain to climb, I think, in terms of how we collaborate and how funders do like take accountability and kind of help push things forward. And it's not all on the community shoulders as well. So yeah, how we can do that together is a big thing for us in the next couple of years.
Thanks, Kirsty. There's a theme that I'm bringing together a little bit. So there's one definitely around challenging decision makers' understanding of what evidence is. I think that was a really strong one in terms of, particularly from the community research partnerships, so kind of really highlighting that value and then bringing in maybe some from the creative co-production group as well, in terms of, you know, particularly using arts-based methodologies, that things that are a bit more kind of creative, and how that might particularly work for people who are the most marginalized, who aren't seen in traditional research systems. So I don't know if anyone wants to speak on that in particular.
Yeah, I think there is a real challenge to get decision makers, policy makers and whatnot to really value what I personally, I get sick of hearing people saying, oh, it was a very small study. This has only got limited applicability, and that's not always true. And I also get fed up with people saying, oh, but we do understand qualitative research and we do understand small sample sizes, and I don't think they do. I think there's policymakers are still driven by big numbers, and there's still a gold standard of what research is, and it's not community-based research. And I think there's an onus on everyone in the room to make people aware of the value of doing community-based research. There's often much more immediate impact for the people who are involved, and it's more about the sustainability longer term that's tougher because of the short-term funding and that kind of thing. But I think often communities, if they like something, if something's been successful, communities find a way to make it work. But then that puts the onus on the community and not the decision makers and the funders and whatnot to actually help sustain things. So it's tricky, but I think we definitely need to raise the value and the status of community-based research in certain forums beyond this one.
Absolutely. I think even within some of the research funders that we are working with, you know, very often you're fighting within a silo, it feels. You know, you've got one team who really agrees with this way of working, and then that's within a much bigger ecosystem, so they have to do internal advocacy all the time as well. Any other reflections on that in particular?
Speaking about the creation and the kind of creative ways of research, and obviously in Shetland we're very lucky. We've got open guys over there that they use some very creative ways, and I think some of the most successful things I've seen where policymakers have been in the room and have really bought into it were anything that strips that dynamic and that power balance. And I think creative methods are really the only way that we can do that. If we can put everybody on a level playing field with some of those methods, certainly from the examples we've seen locally, it's the only way that you can get that power balance to shift. I'm not sure if there's other areas or other kind of examples that people have of that, but certainly in Shetland we had a corporate parenting board which we changed based on what the kind of care experienced community felt they wanted, and that was lots of creative methods, and it was really exciting for everybody to take part in. But most importantly, practical changes have been made or are being discussed because of it, and it's because of that relationship based again, and because of those power dynamics broken down that little bit.
I also feel like there's something about the power of stories that can be conveyed so strongly, and I also have this cynical part of me which is about if policymaking was evidence-based, I feel like we'd be in a very different political situation, to put it mildly. But we know stories are important, and these methodologies can be ways of generating kind of stories, and that can speak to people. And that certainly gives me hope. We're going to slowly start closing, but I mean, there's so many things to start breaking down here, so we are going to write down all these different suggestions. But what I'll invite you as a kind of final reflection each is maybe something that you're going to not just take away, but almost kind of action or commit to based on what you've learned from and heard and thought about today. And Louis, I'm looking at you, so you're right next to me, so you're going to go first.
I did joke that this is like Jerry Springer's final thought. We're hoping nobody boos or anything like that. For me, straight away, we were speaking about at our table things like feedback and communications, and straight away I'm reflecting on times when I could be better at that. So on a purely personal and professional level, I'm thinking of people I need to email tomorrow or start getting in touch with where I probably could be a lot better, I would say, at that. So that's that kind of straight away a practical thing. But for me, it's about relatively new to this world, I suppose. And I think trying to explain the value of all this to some of my peers and some of my organisations I work with would be the next thing I'll be doing.
Thanks, Louis.
Okay, so I'm going to talk more from a UHI perspective, because UHI has part of its vision and mission, if you like, to serve the local communities of the Highlands and the Islands. And tomorrow we've actually got another workshop that Science Ceilidh's doing with us, with researchers in the university, because I would like to see many more community-based research projects on the go that benefit the communities. It's not just one community. And so I guess I'm already thinking ahead from what I'm kind of drawn on from today that can feed in tomorrow to try, and some of the researchers are here today that will also be at our event tomorrow. But I think if we can get more momentum behind this and more researchers buying into it to then reach out to communities, or for communities to feel able to reach out to researchers at the university, knowing that we're receptive to this and that we're not starting off with our own research agendas, that we genuinely want to do work that's going to make a difference and that's driven by the concerns of people in communities. I think that would be a good way forward.
Yeah, so today through the different discussions that I've done, we did talk a lot about how researchers value different people's opinions and views. And for me personally, it feels like, especially in school, whenever we get surveys and things like that, that they're asking really vague questions just so that they can tick a box and say that they have asked and interviewed young people. So I think for me, if I do end up interviewing people about their opinions, I'll try and actively get a wider range of people, wider demographic of people, and just give them all the same questions, because yeah, it is kind of insulting as a young person still in school whenever our views are just not actually taken into consideration, and it's just so that they can say that they have interviewed certain people.
Thanks, Liz.
Thanks, Liz. Yeah, and I think from what I captured from today was that there are quite a lot of connections to be made, that continue to be strengthened between us Central Belt folk and the people in the Highlands and the Islands, and that I guess that the future for me, for my work and the community that I keep and hold in Edinburgh, is to strengthen the bonds and the relationships that you make. And often you're at these conferences and you don't have, like, you have a meaningful chat. I had a meaningful chat with Marianne. Hi, Marianne. and on our listening walk, which is lovely, and like trying to take that forward and make it so that you don't just lose it. And, you know, the plea I made in the Padlet was to be able to see who was there so you could take this forward so that we aren't going back into our offices or into our homes and losing what could have been a very meaningful connection, because all we have in this world is our relationships. So thanks for letting me be here.
Thanks, Anna.
I think I was sort of reflecting upon where working with kind of large-scale data, that data needs to reflect what's happening in communities, and how can we think about that data and how can we make sure that it does reflect what's happening in communities. And I think listening today, there's so many like passionate people and networks and groups that want to be in rooms and want to be where decisions are being made, and there's people that are wanting to connect with those. So I think I'm going to take away some to you where can I create connections or help bring those people together, and kind of support that happening more, rather than it happening in isolation.
Thanks, Katie.
Thank you. Yeah, God, I'm really reflecting on the last time I was at this gathering. It was like 18 months ago. Yeah, and
A whole baby.
A whole baby since then. And yeah, I think it's another amazing event. Well done to the Science Ceilidh team. But I think it feels, I don't know, I'd really interested to hear what other people think who were here last time. But I feel like this work's really quite like established for a lot of people now, and it's. Yeah, it feels like it's a shifting and like a step forward, I guess. It felt really new to a lot of us a while ago. Only a couple of years ago. That's not that long ago. And yeah, there's loads of new faces as well, loads of new interest, and I think that's really exciting, actually. And one thing I'm taking forward is, kind of off the back of your comment, Louis, is about demonstrating the value. And I think from the Ideas per Fund, for me, like, how can we help you, from the Ideas Fund, how can we help you demonstrate the value to your peers, to your institutions, colleagues? That's definitely our job in the next couple of years. Like, how do we gather? We know this work is, like, there's a lot of good stuff coming out of it, solutions, impact. As we're gathering the stories of that, like, how can we help package that up for you, or how can we help tell those stories so that people do value this work and see, that it's impactful and worth funding and worth backing and collaborating with. So yeah, that's an ask if anyone would like to come and chat more to me about that. And yeah, thanks so much, Lewis and Science Ceilidh team. I think we all really appreciate your work and massive efforts here. So.
Oh, thanks, Augustine. And yeah, can we say a massive thank you to our panel? Really appreciate your reflections there. So Louis, Anthea, Liz, Ala, Casey, and Kirsty.